All right, so today we're going to do a little bit of a media training on how OCD is often portrayed in TV shows and movies and how that can be improved. So the first misconception we'll talk about is that OCD is just about cleanliness. And two examples of this are Monica from Friends and the TV show Monk. And these characters are often seen cleaning or being really focused on things being orderly and neat. And the problem with this is that it often misrepresents and oversimplifies a complex condition. And this is the main stereotype you'll see in the media, and it's often used as a source of humor. And the problem is that this is just one of so many compulsions that someone with OCD may have, and media can definitely improve this by consulting with experts and making sure that they show the internal struggles that these characters may face, including seeing different sides of them in different parts of their life, that they are not just their compulsions. And they can also work on avoiding generalizations about cleanliness for comedic effect.
Another common misconception that the media pushes is that OCD is not treatable. On the contrary, between 40 to 60% of people with OCD can see significant symptom reduction through a variety of treatments. These treatments include both medications and behavioral interventions. Many people with OCD have benefited from cognitive behavioral therapy, antidepressants, and other medications such as anti-anxiety medications, deep brain stimulation, residential treatment programs, and transcranial magnetic stimulation. Many people with OCD will try one or more treatment options or will try out several different treatment options until they find the intervention that works best for them.
Another misrepresentation of OCD in the media is that it's helpful or beneficial for characters instead of showing the full reality of someone's lived experience with OCD. Obsessions and compulsions are debilitating and stress-inducing, but some shows or movies use these to solve cases, fix problems, or make big realizations. One example of this is in the show Monk. Some of his characteristics of OCD, such as extreme attention to detail and observation, prove essential to helping him solve cases. One study of this show surveyed respondents who had OCD and anxiety for their reactions. While most respondents weren't super critical of the portrayal of Monk, many felt it didn't show the full picture or the seriousness of the disease. Another example in the media is Khloe Kardashian's CloCD campaign. This portrayed OCD as something positive that gets you to clean and get things done around the house. As part of the campaign, she says that she's thankful for it because it has helped her get her house into order. Though OCD, like any disability, can come with some effects that some might consider to be positive, such as greater empathy or increased understanding of others, focusing on these effects while diminishing the extremely negative effects is a very incorrect representation, and it minimizes the experiences of those with the illness.
Hi everyone, today I want to talk about a common myth we see in the media and everyday language, the idea that OCD is just a personality trait. You've probably heard someone say, "I'm so OCD," just because they like things neat or organized. But OCD, obsessive compulsive disorder, is much more than that. OCD is a chronic mental health condition that involves unwanted, intrusive thoughts called obsessions and repetitive behaviors or mental acts called compulsions. These aren't preferences. They cause significant anxiety and distress and often interfere with daily life. When the media presents OCD as just being picky or clean, it misinterprets the disorder, minimizes the experience of those living with it, and can lead to stigma or delayed treatment. It's important we understand the difference between quirks and clinical disorders and speak about them respectfully. Let's pass that forward.